welcome to Live United. My name is Karen Knapp, President CEO, United Way of St. Lucie County. United Way's mission is to improve lives by mobilizing the caring power of our community. We invest in programs that provide the most impact on the residents of St. Lucie County. The dollars donated to United Way stay right here in our community where they'll do the most good. Today we have some visitors, and I would like to welcome Healthy Start Coalition. Healthy
okay.
Start. Lisa Von Seelen, welcome.
Thank you.
And you are relatively new to Healthy Start. I mean, you've been there a few years, you have made such an impact in the short time that you've been there. You've really improved the agency and kept it going and improving lives of the very young in our community. Let's talk about the mission of Healthy Start Coalition.
Sure, thank you. Yeah, it'll be 4 years next month, so time has flown.
Yeah.
But it has certainly been a great experience. We had some challenges. Of course, Healthy Start's mission is for every baby born to be a healthy baby and to be able to thrive into adulthood. So that entails a number of factors across the spectrum, from having, most importantly, a mom healthy prior to becoming pregnant, and certainly getting the prenatal care and services that she needs during her pregnancy. And then, of course, having a safe sleep environment and good protective factors in place, parenting education, when that baby is born, and new moms and dads are going through that experience, which is lots of activity and not so much sleep.
There are many programs that you provide. Let's talk about a few of those programs.
Sure. Healthy Start Coalition was actually is a continuum of care. So we have the core program that is primarily funded with state and federal dollars, and then we have our local funding from United Way and Children's Services Council that funds our newborn home visitation program, which is very exciting for me because that ensures that every single mom who gives birth is offered a home visitation, and that's by a registered nurse. So they get a visit, they get a medical exam, mom gets checked on, the baby gets checked on, and that's within the first 3 to 5 days of her being discharged from the hospital. So it's a really critical time for lots of things to go wrong, and when babies and moms can get readmitted to the hospital or not, and sometimes with very dire consequences. So they provide a real critical intervention that can catch any kind of problems, infections. If they catch heart arrhythmias for the babies, they do. They give the baby a weight check, so if they've lost more weight than is typically expected, or mom's having trouble with breastfeeding, they can hook them up with the needed services to really ensure that they have the services that they need, that we're reducing any risk factors and we're increasing their protective factors. We also have the teen case management through Children's Services Council, and they work with teen moms who are at the highest risk for poor birth outcomes. So that's another very specific population that we work with. Again, on the front end, very oriented towards prevention. We also have the Parent-Teen Community Connection, which works to keep teens from getting pregnant and making healthy decisions and having good, healthy discussions with their parents. So that's really about communicating parents and the teens. And then we have the Safe Sleep program, which basically ensures that moms or dads that don't have a crib or safe sleep environment can get a crib or a pack and play through Healthy Start. And that requires them to take education classes, but we also are able to do a home review and make sure they have things like smoke detectors, and if there's any other kind of risk factors, that we can talk to the parents about those and help them again with resources to ensure that they have a safe home environment for the baby. I'm forgetting another program, but basically we have a continuum of care programs that aim to prevent infant mortality and also low birth weight, because our premature babies and our low birth weight babies are some of the highest risk, and they're also some of the most expensive. So whereas a full-term baby costs around $4,000 to deliver, a preterm baby costs about $54,000. So that's a significant cost. And especially when you consider that many moms don't have insurance and they're not covered, the county ends up bearing those costs as well, and the taxpayers. So if we can prevent those from happening, we're way ahead of the game, and it affects the rest of their life. So not only are we preventing those high medical costs, we're preventing developmental disabilities. We know now that risk for becoming involved in the juvenile justice system actually starts in the womb, and moms that are exposed to chronic, intense stress during their pregnancies are much more likely to have children who end up in the juvenile justice system and the adult criminal justice system. They're also much more likely to end up with diabetes and heart problems. So it's things that we're finding out now that are just amazing, and the effect over the life course of an individual, that we can really make an impact before they're even born.
So talk to us a little more in depth about that. You know, you send someone out, someone's signed up in the first place. How do they sign up? Where do they go to sign up for this?
And Healthy Start actually was enacted by the late Governor Lawton Chiles in 1991, and our Healthy Start Coalition started in 1994. So we just celebrated 20 years of that, and Lawton Chiles had a grandchild that was born severely premature, and that is what opened his eyes to the need for the program and early intervention. So we are the only state that has a Healthy Start mandated by law in legislation. So every doctor is mandated to do a screen on every pregnant mom and a screen on every new baby. They can opt out of services, but they're offered services, and that screen is an assessment for risks. And so the doctor lets them know what their risk factors are and what services are available to them should they choose to get involved. Some moms may not have any risks, and they just want classes because they're new moms and they're nervous, or maybe they don't have a support system in place, so they can always self-refer in as well. And even if they choose not to at the first visit when they find out they're pregnant, if later on there's any changes or they just change their mind, they can call our care coordination office and again self-refer for whatever their needs are.
So once back to my original question, let's talk about the continuum of care. When someone from Healthy Start meets a new client, do they go to the home, and you said they check the home out? What else do they offer? They offer other services, or
we do.
How comfortable? And then talk about the comfort level of the client. What do you see? Are women seeking this help? Are they? I'm sure they're in need of the help.
Right.
But do you find a lot of cooperation?
We do. Again, it's a voluntary program, and we are just there to help with as little or as much as they need. Again, some moms may just need education classes, childbirth classes. They might be interested in breastfeeding classes. They may need more service, like case management during their pregnancy. So we start with, again, the highest risk is where we're going to focus. So a mom have high blood pressure or other risk factors, and she might have a previous loss. Or poor birth outcome, then they would fall into a higher risk category. If they are substance abusers, we will hook them up, of course, with counseling and treatment if they are interested. And again, just educating them on the dangers to the baby. If they're smokers, that's also another high danger. So we have a smoking cessation program, that's the SCRIP program, that's evidence-based and has been very effective. So we have an addictions counselor that also works with moms who are smoking or maybe using drugs or alcohol, prescription or otherwise. We have Healthy Families program, which we would refer in if there's other risk factors for abuse, such as existing abusive situation, domestic violence, so that we can get some additional support in that home and over a longer period of time. For Healthy Families, they can work for the family for 3 to 5 years. So with that identified child, and they have been extremely effective in preventing child abuse. It's one of the most effective programs in the country, and we are one of the top programs in the state. In fact, it just won an award, Healthy Families Florida, for the first statewide program to have accreditation without any necessary corrective actions. So that was very exciting, and of course our Healthy Families locally was also recognized and has been every year that I've been there for their successful outcomes and being the top leader in the state. So
Great,
it's,
wonderful. Is there a cost to your program?
There is no cost to our program. It is free. We are funded, as I said, through our state and federal dollars, and then the United Way, of course, as well as our Children's Services Council. So it's just an awesome use of taxpayer money, really for a great investment, because it reduces those costs on the deep end, and it's relatively low cost to ensure we have healthy moms and healthy babies.
Great. Let's talk about upcoming events. It costs money to put, to run a program, and you're funded by United Way, but many of our agencies also depend on the events that they put on. Let's talk about some of those that are coming up.
Thank you. Absolutely. We do have our annual St. Lucie Luau, which will be April 17th. We have it at a new venue this year. It's going to be actually at the Riverwalk Center on Indian River Drive, newly renovated. It increases our capacity and allows us not to worry so much about weather. So we're very excited about that. And the whole concept of us having a luau as a fundraiser was that the luau is a traditional Hawaiian celebration, and if a baby survives its first year of life, it's much more likely to survive into adulthood. And so the luau was a celebration of baby's first year of life, because that meant they were probably going to survive, and it was a great reason to have a big celebration and invite all the island family and friends. And so that's why we have that as our signature event. We do have our annual luncheon, which typically takes place in October, so that's a bit of a ways off, but we have our General Coalition meeting that is also open to the public, and that will be in April, but we have not have a definitive date on that yet.
They can go to your website, right?
Absolutely, which is www.kidsconnectedbydesign.org.
And you need volunteers. So many of all of our agencies rely on volunteers. Let's talk about your need for volunteers.
We do. We have a great need for volunteers, not only, again, for assistance with fundraising, so we have opportunities for board membership, we have opportunities for committee membership, we have opportunities to volunteer for events like the luau. We have capstone student opportunities, we have internship opportunities, we can use clerical help at our care coordination office. Whatever your desire is, we can find a place to fit you in, whether it's a one-time day volunteering with, we have a Just Between Friends does an annual sale of items that are typically for moms and families that they do at the St. Lucie Civic Center. And at the end of the 3-day event, if there's any left things that did not sell, they donate. And so we have a partnership with Graceway Village, and they actually have their shop. So it allows our moms and families to go shop there, and the items we get from Graceway. So we have to provide volunteers for that 3-day event as well. So you can sign up for something as little as a 4-hour shift to attend all 3 days, or to work with us year-round. So lots of opportunities to get involved.
Well, it sounds like you're doing a wonderful job, and I wish we had more time. Thank you for all that you do for our community, and we'll be right back.
I'm lucky. Let me help you with that. I get to do something I love. It has nothing to do with touchdowns or titles.
Everybody bring it in.
I get to play a part in the life of someone just starting out.
How many of you think homework is just as important as teamwork?
I help keep kids in school.
Good.
And that's the name of the game.
My name is LaDainian Thomason. I don't just wear the shirt, I live it.
Give, advocate, volunteer. Live United.
Welcome back to Live United. Our guests right now are from Graceway Village. Kathy, welcome. Sonia, welcome.
Thank you.
So nice to have you here with us. Graceway Village is a very young agency, but it is a very powerful, impactful agency, and you've done a terrific job in our community. Very good reputation of helping people. United Way is very proud to have you as one of our agencies. Kathy, you're the new executive director. Let's talk about the mission of Graceway Village.
The mission of Graceway Village is to help those in need for clothing for their children, as well as for food, as well, on top of that, getting out of taking classes as far as to help them get out of poverty. Any way that we can strengthen the families in our community, in whether it's materially, financially, or spiritually, we're all about that.
And this is a special year for Graceway Village.
It is. It's our 5th anniversary. We served our first client in March in 2010, and we served our first meal in April 2010. So we're very excited.
Do you have a waiting list, or do you have a lot? You must have a number of people that utilize your programs. Is there any type of a waiting list, or do you just take them as they come?
We take them as they come. We've not had a need yet to have a waiting list, although just in 2014 we served over 2,000 children regarding clothing for their first visit, and they can come twice a year. And so you can certainly multiply that probably by 30 to 40% to get the accurate number of children we serve, and we can do it without a waiting list.
And Hope's Closet, that's one of your programs,
Yes, ma'am.
Very well known throughout the community, helps so many people, clothing them.
Yes.
How do people find out about Hope's Closet? And let's talk about when they arrive, what are they going to find?
Oh gosh, I don't know which way to start first. When you get to Hope's Closet, they find a boutique-style setting in a retail-type atmosphere where the mom and the children can come in and shop for themselves, just as if they were in a regular store. We have wonderful volunteers who are with them, and they assist them wherever there's a need, but the kids get to choose their own clothing, and the moms get to do so as well. So that alone is a focus of ours. We just want to surround them with respect. We know that life's hard, and so in any way that we can give them a very normal and respectful experience, we certainly would emphasize that. Trying to think, how they can find out about Hope's Closet. We have over 66 referring agencies. They do have to receive a voucher from one of these agencies in order to come to Hope's for the first time. And they can locate those on our website, which is gracewayvillage.com. They list all the agencies, of which every public school in St. Lucie County is a referring agency, so they can just ask the health aide at their school as well for that assistance.
And of course you need donations, because once the clients come and they get what they need, you need to fill that gap. So what are the needs of Hope's Closet?
Continually clothing. I mean, on an average Wednesday, we can easily give out over 1,000 pieces of clothing. And so we're only open once a week, Wednesdays from 10 until 5. And if you think about the amount of clothing that goes out every week, it's a constant need to have clothing drives. We also have drop box at Indian River Presbyterian Church, as well as a couple other locations, and we have a very big drop-off box at our facility on Hartman Road.
And are you looking for specifically shoes for
boys'
certain age
shoes
groups?
especially, absolutely. Boys' shoes, they're always in need for, particularly teen boys, and boys' clothing. We find there's fewer donated, and it's probably because boys are harder on their clothes. And
we all know that.
Isn't that true? We don't take any clothing that we wouldn't put on our own children, and so when boys wear their clothes out as much as they do, it's a short supply.
And your other program is Matthew's Cafe.
Yes.
Tell the audience about Matthew's Cafe.
Oh, it's one of my favorite. It's every Sunday from 5 to 6. It's the only place where individuals can go in St. Lucie County to get a free, warm, hot meal on Sundays. And that's why we started Matthew's Cafe. We saw that there was nothing available for them on a Sunday, and we said, well, we can meet this need. And so we have a lot of regulars who come every week whom I love to visit with, and every week we get new families and individuals who come as well.
You're probably seeing more people, or you have, over the past few years than ever before, with the downturn in the economy. Let's talk about the need that's out there.
We find the first of the month is the hardest, and in some ways it's the hardest for our heart, but it's also the most encouraging for what we do. The checks have arrived by that point, and so individuals who aren't as much in need, we don't see them as much the first 2 Sundays. The ones we see are the ones that even when the checks arrive, still are in desperate need for food. Some of them don't get checks, and so it's so nice to it's like they're coming home. Every Sunday, visiting home for a Sunday dinner, and we're able to give them, we really focus on nutrition, and so we're able to give them a fresh salad and a hot meal, and of course a delicious dessert, which they would never be happy if they didn't get. But
And Graceway Village offers long-term help to individuals and families. Let's talk about the Getting Ahead classes.
Yes, the Getting Ahead classes is actually the individual component off of Bridges Out of Poverty. And I've been facilitating the class with another facilitator, Kevin Singletary, since February. It is an evening class, and it is designed to help individuals who are in either situational or generational poverty to get out, to change their way of thinking, and to basically change their future story. So it's a really unique program. I'm excited to be involved. The individuals are called investigators, and we as facilitators are co-investigators, so we learn together, we hurt together as we investigate the needs of the community, what's going on, and then we bring it to an individual level. And it's just been a great program, and seeing the results working, or the program working already.
So it's like helping them find resources that are
Yes.
necessary, and actually showing them what happened in their life that got them to that point, and what they can do to get out of that and be a
Right.
more of a productive citizen in St. Lucie County.
Right, right. And one of the most important things is realizing that financial is only one of the resources that can be lacking, but there's actually 11, such as lack of emotional resources, or spiritual, or relationship, lack of role models, and so forth. So that has really been eye-opening for me as well, you know, getting involved in learning.
At United Way, we discussed the Getting Ahead class along with Bridges Out of Poverty, and that's part of that.
Yes.
And how, if we can really join as a community together to support this, it can help our economy. Because if you can tackle the issue at the root level and help people by giving them, you know, a step up,
Right.
then it's going to help everyone else. It's going to be a domino effect.
Absolutely.
Let's talk a little bit about what happens in the class of Getting Ahead class.
Okay, so it's a 3-hour program. Class, we meet twice weekly, and during that class we follow the Getting Ahead curriculum. It's discussions. So even though we're facilitators, we're not there to teach or evaluate or say you need to do this or that. But it's basically exploring the community. We create models, mental models of the community. We create models of the different classes, poverty, middle class, and wealth, and just learn together. We explore predators in the community, predators being predatory lenders or pawn shops, and it's really eye-opening to see them learning on their own. It sounds really weird to some people, like, well, how are you going to have a class without teaching? But it's just awesome to see it come together in those aha moments, like, you know, wait a minute, what's the percentage rate or the interest rate? And coming from the concrete thinking to the abstract, from the tyranny of the moment decisions to really thinking about how is this decision going to affect me long term, and my future story is what it's called. So discussions, we have a break about halfway through. There's lots of drawing on the notepad, and you know, it's not us standing in the front, but it's actually everyone getting involved, reading along, asking questions, setting their own rules as far as class participation even, and you know, what time are we going to come back from break. So it is truly participant owned. The learning is participant owned, and it's just great. It's something different than I've ever been a part of. So.
And it's all voluntary at no cost?
That's right. That's right. It's free, and they actually receive compensation at the end of each class for attending, which is really awesome. But what we're finding is, though, even though some people may have gotten involved because of that, they're getting so much more out of it than they imagine. And I think that, I know in the end we're seeing that, you know, that's not the end motivation once they're here. So.
What is the greatest strength of the program? What do you believe is the greatest strength?
I believe the greatest strength is the learning environment, and that there isn't someone saying you need to do this, because everyone's situation is different. It could be generational, it could be situational. we're seeing, based on the mental models that we do, that, you know, everyone's home life is different. You know, they're everything. And so by them taking their ownership for their own learning, I think it's more impactful, and it enables it to be long term. It's more than just giving someone a job, but it's the actual change in thinking and thought process. And so I think that is a huge strength.
And this is your the second class or the third
Actually,
class?
this is our 5th class.
Oh, 5th class.
Yes.
It's our 5th
Where's
class.
my head?
I know.
My first, yes.
It's her first and our 5th class
Yeah, our
that will be
5th class.
graduating on April
All
6th,
right,
actually.
okay.
Yes.
It's our first nighttime class, though. First nighttime one in
All
our
right.
area. So
Do you find that more beneficial to have the class at night than during the day?
we certainly do now. We weren't sure if we were going to get much of a response, but there were a lot of individuals who couldn't do it during the daytime. So we filled up very quickly. We got about 50% of our class came from Hope's Closet, which I thought was fascinating. And within an hour and a half, we got half of the applicants for the class. Just from Hope's Closet in one particular day. But if you think about it, these are parents who are very focused on the needs of their family, of their children, to the point that they'll come and they will get clothing for them. And so it really wasn't too surprising to see such a positive response to them.
So you're not just giving them a handout at Graceway, you're giving them a hand up.
That's
and
very
that's what
well
we
said.
want.
Very well said.
And to help you do that, you need volunteers. I know that there's a woman in my office that volunteers every Wednesday. At,
Yes, every
Hope's
Wednesday
Closet.
afternoon.
So the need for volunteers is great.
It is. Well, the volunteers make the organization. It's a very small staff otherwise. And Hope's Closet, they work with the clients. They each have shifts where they work with the clients, as well as working in the sorting room, because again, we get all those donations and someone has to sort through them. And then Matthew's Cafe, we also need kitchen help and service help on Sundays for that.
And where's Graceway located?
1780 Hartman Road, Fort Pierce, Florida.
In Hartman Road, give our viewers a little idea on where Hartman Road is located.
It intersects with Okeechobee Road. It's very close to, well, it's right across the street from the school board offices and other entities. Used to be the mall, long time ago.
Oh, I remember that.
Yes.
Well, Kathy and Sonia, I want to thank you for joining us. You're doing a terrific job. And it's about time to say goodbye. Thank you for joining us. And if you'd like to volunteer or give, please contact United Way, or directly you can contact either Graceway Village or Healthy Start. Thank you for joining us.